Hello guys, and welcome back to the channel. So in the video today I'm going to be talking about some non-clinical healthcare jobs that are available in so many hospitals, and it is very good for those who want to work in the hospital but they don't want to actually be directly involved in patient care. So I'm talking about people who don't want to be nurses, they don't want to be doctors, or they don't want to be any other clinical staff that is directly involved in patient care. One thing that you need to note is that everyone that works in the hospital, from the clinical, the non-clinical staff, all of them, they take part in making sure that every patient that comes to the hospital has the utmost care or gets the utmost care. And the first job that I'm going to talk about is a patient administrator. A patient administrator is sometimes called a medical receptionist. So this is because they are actually based in the front office, right? So mostly in the outpatient setting. They are also found in the inpatient setting. So we call them IP patient administrators. That is inpatient patient administrators. So we also have about three different types of patient administrators. We have the IP, which is the inpatient patient administrators, and they take care of inpatients. So these are patients that are supposed to be maybe for surgery. These are patients that are supposed to stay in the hospital for more than like a day case, even for 6 hours, for 12 hours, or for more than one day. So that is IP. Those are inpatients. So they are going to use the hospital bed. They are going to sleep in the hospital. And we have the OP. That is the outpatient patient administrators. So these are people that you mostly find when you go to your normal, let's say, checkups. And if you go to see a doctor or you go for consultation, you're going to meet these people at the front. They're going to ask for your identification and the reason for why you are visiting the hospital. So these are OPs. These are outpatient patient administrators. So we also have the EP, that is the emergency patient administrators. So these are the people that you mostly find when you visit the emergency department. So those are the three different types of episodes that you find in the hospital. So you find the EP, the emergency patient administrators, you have the IP, the inpatient, and you have the OP. They are the first point of contact that the patients are going to have. In the OP, when you're going to see a doctor, you're going to meet the receptionist or the patient administrator, and they are going to ask for your identification and all that, and they're going to book an appointment for you, or they are going to do the necessary things that I need to do, get identification, and if you need to make any payment or any blood tests and all that, or any scans, if you need to pay any money from your pocket, you're going to pay at the counter. Sometimes they act like cashiers at the same time. So those are patient administrators, and this job is sought after. If you go to every hospital, you are going to find patient administrators or medical receptionists. So they are in every single hospital, and this job actually requires little or no experience. You just need to know a little bit about customer service. You need to know a little bit about medical terminology, which you can learn online and you can learn on the job. So the job, for example, in the UAE, this is in Dubai and Abu Dhabi and in the other Emirates, it pays on a base salary, it pays you about 6,000 dirhams. So in a good hospital, you get starting salary 6,000 dirhams, and it goes up to about 10,000 to about 15,000 dirhams, depending on the hospital and depending on the experience. So when you start with a base of 6,000, it's a good salary for those who are in Dubai or in the UAE in general, or in the Gulf region. 6,000, you start with that, and you can grow from the job. You become a patient administrator, and you can become a patient admin supervisor, and you can definitely become a front office manager, right? So there's a lot of progression there that if you upskill yourself, you can definitely get growth in the job, and you can definitely grow in your career and make a good career for yourself. Another amazing vacancy that is always in many hospitals, especially in the UAE, is usually for medical coders. So that is the second job that I'm going to talk about. So medical coders are an important part of every facility. So be it a huge hospital, a small clinic, any small facility, medical coders are very important. Even insurance companies, they need medical coders, because the medical coders are the people who actually translate, or let's say these are the people who create codes for all the diagnosis and all the operations that take place in the hospital. So, for example, maybe you are suffering from a particular illness, or a doctor needs to perform a surgery on you, like for example, laparoscopic cholecystectomy, for example, and that doctor wants to do that procedure, right? So the medical coder will be the one to actually get that code, and that code is used not only in that hospital but also sent to the insurance company when they are applying for insurance approval. So it is like a general code that is universally recognized, right? So they create that code from the diagnosis of the doctor, then they can pinpoint the exact, through the code that they create, you can actually pinpoint the exact operation that is going to be done on that patient. So medical coders are an important part of every hospital or every healthcare facility where insurance is involved, and even cash payments. So it is very important, and it is a good field. You can actually learn a medical coding. You can actually go into medical coding with little or no experience. You can learn for about 2 to 3 months, and you take the exam. It is an international exam that you need to take, and once you take the exam, you get certified and you can apply for jobs anywhere in the world. So medical coders make from 7,000 dirhams in the United Arab Emirates in a good hospital, and they make up to about 12 to 15,000 with experience. So it is a huge market, and they are highly in demand in the UAE and in different countries worldwide. So that is a good career opportunity that you can pursue, and advise that you look into this for those who want to work in the medical field, for those who want to work in a secured environment. Their jobs are secured, and definitely this is a good field, and you make good cash, and you always get a job out there. The third job that I'm going to talk about today is medical secretaries or unit secretaries, or what we call again ward clerks. So in Canada or in the US, in the UK, and in some different countries like Australia, you can actually call them ward clerks, and you can call them unit secretaries, or you can also call them medical secretaries. So in the UAE, they are also called ward clerks, unit secretaries, or in any different name that they want to use. So who are these people? I'm actually talking about this job because this is for those who want to work in the medical field, and they want to get an idea of what the medical field is all about. It is a good field. It's a good job for you to, because you actually work in the medical field in a limited capacity, but it will help you to actually learn the pros and cons. You know so much, especially if you work in an inpatient setting, and maybe you want to become a nurse and you want to go to school and actually work again part-time. It happens. I know so many people doing this, especially in the US. Many people are doing like this. So you can work night shift as a ward clerk, and you can go to school the next day. So it helps you to really understand the healthcare environment, and it makes you to also have an idea of what it entails to become a nurse or a nurse assistant or any career that you want to pursue. So it gives you a good understanding of the job, of what you are getting into. So, and it also pays really well because it is an entry-level position, and you don't actually need any experience. So a ward clerk or a unit secretary is someone who works in an inpatient or an outpatient setting. In an inpatient setting, they'll work in the reception in inpatient settings, and they'll just help the nurses. They'll help in their administrative duties in the department. So like they'll take care of the stocks, the consumables, and they'll make sure to replenish their consumables. They'll take care of scanning of documents and all that in the inpatient setting. In the outpatient setting, sometimes they are tied to particular doctors. So for example, a cardiothoracic surgeon can have a clerk. They are called OPD clerks, that is outpatient department clerks at that time. So a cardiothoracic surgeon or a general surgeon can have a clerk with him or with her, and this clerk is there to do their clerical work. So they book appointments for these doctors and give sick leaves and all that. They prepare discharge summaries for the patients of those doctors and all that. So it's a very interesting job, and it actually helps you to get a good understanding of the medical field. And it is good, really, really good. So it pays in the UAE, it pays from about 4,000 dirhams in a good hospital up to about 8,000 dirhams if with experience, and also if you actually work in a good facility. Another important part in every hospital that people always don't look at is the biomedicals and engineering department. What is the role of these people and what are the jobs available there? So if you're someone in the engineering field and you have a knack to work in the hospital, right? So you have different jobs in this field like biomedical technicians, biomedical supervisors, and biomedical manager. You also have plumbers, same in the same category, in the same department. You also have electricians and so many other different roles that you can have in this department. Imagine you are working in a youth facility and you are using something like a syringe pump or an infusion pump, and it gets bad and something goes wrong, and you actually need to fix it, or they need to do something to actually calibrate that machine. You are going to call the biomedicals department. They are going to rush into that department. They're going to rush into that area where you are and try to fix that infusion pump or that syringe pump. Same thing with the ventilators and every other machine that is being used on a patient in the hospital. So they are the people in charge of that, which is very important. So you see the role that they play, right? So they play life-saving roles in the hospital, because all the life-saving instruments that are used in the hospital are actually connected to the biomedicals department. Another important department in the hospital that you need to look at if you are looking for non-clinical jobs is the CSSD department. So this is a Central Sterile Supplies department. It simply deals with the sterilization of instruments in the hospital. So what are some of the roles available here? You have a CSSD supervisor, you have a CSSD technician, right? So these are roles in the hospital that pay you very well, and you just have your own special place. You have a Central Sterile Supplies department, an area in the hospital where all the instruments that maybe they use for surgeries, they need to send back to the department for sterilization. So they need to make sure that these instruments are sterilized, they are well kept and prepared for the next surgery, right? So it's an important part of every department, and it is highly regulated, not only by that hospital but by the health authority in the UAE and every single country. For CSSD technicians in the UAE, they make from 7,000 dirhams and above. That in a good facility they can get up to 10, 12 to 15,000 dirhams. And you have CSSD supervisors, so there's a lot of progression also in this career, and these are people who are highly sought after in so many departments. So if you are looking for a job, or you're looking into getting in the medical field and you want to do a short course, you can take a short course into CSSD and you can get a certification and you apply for a job. Another important part of the hospital that always has some vacancies is the medical supplies department. This department is really essential, and it has so many different jobs that you can get if you want to work in a hospital. So from the transport supervisors to the drivers, they are always there. You always need them, right, in every hospital. Another part, you have the consumables section, where you have the consumable officer, who is the person that is always in charge of a particular hospital, right? So the person manages all the consumables that come into the hospital from vendors and from their central store and from different areas, from consignments to stock items to non-medical items. All these things are being managed by the consumables officer, right? Below the consumable officer, you're going to have different people. You have store coordinators, you have stock controllers, and you have store assistants, and so many different positions under this role. In this same department, you might also have purchasers, you have buyers, right? So in this same position, you have different categories of people, and you have different roles and different jobs that are available. So if you are someone interested in the transport and logistics department, and you have a knack to work in the hospital, then you can actually apply to these positions: store assistants, store controllers, store coordinators, and consumable officers. You have purchasers, you have buyers, you have so many different roles that you can get in the hospital. You can get a certification. For example, if you're in the UAE and you want to get certification in any of these roles, you can actually get certification from a Blue Ocean Academy. They actually offer a really good promotions. They usually offer good promotions for people to study CPP, that is Certified Purchasing Professional, and CPPM, Certified Professional Purchasing Manager, and also have different certification that you can get if you want to work in the transport and logistics department. And it is really great. I recommend this highly, because I've actually seen their program, and they usually give a 2-for-1 special where you can get a CPPM and a CPP when there's a promotion. So you can get double certification at the same time, and it is highly recognized, and the certification comes from the American Purchasing Society. So in a nutshell, all I'm trying to say is that there are so many non-clinical jobs available in hospitals in the UAE, in Saudi Arabia, in the Gulf region, in the UK, in Canada, everywhere in the world. These jobs are all available. So don't just put your mind only on different roles that are available in hospitals, and if you don't get them, you start getting worried. So there are non-clinical jobs that can help you, and they can give you good money in the hospitals, and you can actually enjoy working in a hospital facility. Again, these jobs are all available, and they require little or no training at all. So, and they also require little or no experience. So these jobs are readily available. All you need to do is prepare a good CV and make sure that you read about the jobs, you get some tips online, you can search about them, you can ask around, you know more about the job. Prepare yourself for interviews so that when you are given a chance, you can actually try to grab any of these roles. So this is just part 1 of the non-clinical jobs. I'm going to prepare a part 2, and I'm going to explain to you more jobs that are available in hospitals, more non-clinical jobs, from high up jobs in the marketing department, in the insurance department, and in so many other different departments in the hospital. I hope this video was helpful to you, and if it was, please give it a thumbs up, and please share the video to someone who might need it, and don't forget to subscribe to the channel. See you in the next video.